A young medical intern had barely pulled on her gloves when a senior trauma surgeon shouted that interns never touched gunshot wounds, especially not on an elite Navy SEAL whose life was slipping away by the second. Every heartbeat echoed through the emergency room as alarms screamed, blood covered the floor, and the wounded soldier drifted closer to death. The room was filled with experienced doctors, decorated surgeons, and armed military personnel. Yet everything suddenly stopped when the dying SEAL forced open his eyes, looked directly at the frightened intern, and whispered her forgotten call sign from a life she had buried years before. In that single breathtaking moment, every person in the trauma bay realized this quiet intern was hiding a past that none of them could have imagined. Before we continue, if you believe that kindness, courage, and second chances can change someone's life forever, please take a moment to like this video, leave a comment, share it with your friends, and subscribe to the channel. Your support helps bring more inspiring stories like this to people around the world. The story unfolded in San Diego, California, where 26-year-old Grace Walker had just begun her emergency medicine internship at one of the busiest trauma hospitals in the United States. Grace appeared quiet, reserved, and almost invisible among the confident residents and seasoned physicians. Few people knew that years earlier she had served as a combat search and rescue medic attached to special operations units before leaving military service after losing several teammates during a dangerous overseas mission. Haunted by painful memories, she never mentioned her military background, choosing instead to start over as a medical student who simply wanted to save lives without carrying a weapon again. She believed that hiding her past was the only way to heal, even if every ambulance siren reminded her of the battlefield she had left behind. Late one rainy afternoon, the emergency department erupted into organized chaos after helicopters delivered several critically injured service members following a classified training accident. Doctors rushed from every direction while nurses prepared operating rooms and trauma teams assembled within seconds. Among the casualties was Chief Petty Officer Matthew Carter, a highly respected Navy SEAL who had suffered multiple gunshot wounds during an unexpected exchange of live fire after equipment failure turned a training exercise into a nightmare. His blood pressure continued falling despite every intervention, and experienced surgeons prepared for a desperate attempt to keep him alive long enough for surgery. Grace stood quietly at the edge of the trauma bay, following every instruction with absolute precision. She understood gunshot injuries better than anyone realized, yet she remained silent because she was only an intern. When one senior physician noticed her moving closer to assist with controlling the bleeding, he sharply ordered her to step back, insisting that interns did not touch gunshot wounds. Grace immediately obeyed, even though every instinct told her precious seconds were disappearing. She knew that hesitation often separated survival from tragedy. But challenging authority during her first month could destroy the career she had worked so hard to build. As Matthew drifted in and out of consciousness, his breathing became weaker with every passing moment. His eyes searched the crowded room until they suddenly focused on Grace. Through unbearable pain, he recognized something familiar that nobody else could see. With barely enough strength to speak, he whispered the call sign Guardian, the name Grace had carried during military rescue missions years earlier. Silence spread across the trauma bay. Grace froze as memories she had spent years suppressing rushed back with overwhelming force. The military officers standing nearby immediately looked toward her in confusion, while Matthew's expression revealed absolute certainty that she was exactly who he believed she was. Grace realized that Matthew had been a young operator she had once treated during a nighttime evacuation after an explosion left several teammates trapped behind enemy lines. She had stabilized him under impossible conditions before risking her own life to carry another wounded soldier across dangerous terrain. That mission had ended in heartbreaking loss, convincing Grace that she could never again survive the emotional weight of combat medicine. Matthew, however, had never forgotten the medic whose courage had saved his life when hope seemed impossible. Without seeking recognition or arguing with anyone, Grace calmly explained the specific injury pattern she believed Matthew had suffered based on subtle signs that reminded her of battlefield trauma she had treated many times before. Although several staff members remained skeptical, one experienced trauma surgeon noticed that her assessment matched the patient's rapidly changing condition. Trusting her instincts, he allowed Grace to assist under his direct supervision. Working with extraordinary calm despite overwhelming pressure, Grace identified hidden internal bleeding that routine examination had not yet revealed. Her observations immediately changed the surgical plan, saving valuable minutes that Matthew desperately needed. The operating room became a place where experience, humility, and teamwork mattered more than titles. Grace focused entirely on the patient, never seeking praise or attention. Every movement reflected years of disciplined training shaped by unimaginable circumstances. The surgeons followed her battlefield-inspired recommendations while combining them with advanced hospital techniques. Hours passed before Matthew's condition finally stabilized. When the surgical team stepped away from the operating table, exhaustion filled every face, but relief slowly replaced fear. Against overwhelming odds, the wounded SEAL was still alive. News of what had happened spread quietly throughout the hospital. Staff members who had overlooked Grace because of her intern badge began seeing her through a different lens. More importantly, they recognized that true knowledge sometimes comes from unexpected places. The senior physician who had ordered her away from the patient approached her later that evening. Instead of defending his earlier decision, he sincerely acknowledged his mistake. Grace accepted the apology with humility because she understood that emergency medicine depended on learning, trust, and putting patients above personal pride. Over the following weeks, Matthew slowly recovered through determination, rehabilitation, and the unwavering support of fellow service members. During one therapy session, he reflected on how Grace had saved his life twice, once on a distant battlefield, and once inside a modern American hospital where nobody knew her remarkable history. Grace, however, insisted that countless others had contributed to his survival. She believed every member of the trauma team had played an essential role, reminding everyone that miracles often happen when people choose cooperation instead of ego. Grace eventually shared her military experiences with younger interns who often doubted themselves during difficult moments. She encouraged them to remain curious, respect every patient, and never assume someone's badge revealed the full story of their abilities. Her honesty inspired many students who struggled with fear, grief, or uncertainty. They learned that courage was not the absence of painful memories, but the willingness to continue serving others despite carrying them. Months later, the hospital hosted a ceremony honoring medical teams and military personnel who had demonstrated extraordinary commitment to saving lives. Matthew attended wearing his dress uniform, still carrying visible scars but standing proudly beside the woman whose quiet strength had changed his future. Instead of focusing on medals or heroic titles, Grace spoke about compassion, preparation, and the importance of believing in people before judging them. Her words reminded everyone that greatness often walks silently through hospital hallways, unnoticed until a single moment reveals the truth. If this story touched your heart and reminded you that kindness, humility, and courage still exist in our world, please like this video, share it with someone who needs hope today, subscribe to the channel, and tell us how this story made you feel. Your support helps keep stories like this alive for people searching for encouragement. Special request: before this story ends, please comment below with the words "Never judge too soon" if you believe every person deserves the chance to prove who they truly are. Matthew returned to active service in a new training role, helping prepare future generations of Navy SEALs while carrying deep gratitude for the medic who refused to let fear define her future. Grace continued treating every patient with the same quiet determination that had guided her through war and into a new chapter of healing. Their remarkable reunion became a lasting reminder throughout the hospital that titles may earn respect, But compassion, courage, and selfless service earn something far greater. Sometimes the person standing silently in the corner is carrying the experience needed to save a life. And sometimes one forgotten call sign is enough to remind the world that true heroes never stop answering the call to help others.